So I'm with Mike Cunnion, the CEO of Remedy Health Media. Mike's been a longtime supporter of New York City health business leaders and a good friend. And Remedy has done so much to help the chronic disease community with its content. So Mike, given COVID, given 2020, did Remedy do anything differently during this past year for the chronic disease community?
Yes, we certainly did, Bunny. The first thing we did was reach out to our users and ask them how they were feeling. What were their biggest issues? How were they navigating life with a chronic condition now that, COVID was disrupting the way healthcare was being delivered, and they shared a ton of information with us. And the second thing, and that really informed us from an editorial perspective, how to serve those audiences in powerful ways. The second thing we did was we created tons of content. I think there were over 100 different pieces created that were specific to COVID and living life with a chronic condition, whether it's HIV or IBD or diabetes or heart health issues. Those pieces, many of which still rank first in search for COVID and that chronic condition, have reached well over 1 million people over the last 8 or 9 months. And that's ultimately the benefit, right? Which is we get to not only listen to our audience and serve them, but we get to see the impact that it has. And that's really what it's all about.
COVID-19 has had a tremendous impact on all of our lives, but for the 60% of people with chronic illness, the pandemic has been particularly fraught. When Remedy Health Media did a survey of 4,000 adults, we learned that 35% of them wished that they had more information on how the virus impacts chronic life. So to that end, Health Central and all of the brands at Remedy made it our mission to make sure we created content specifically to meet the needs of the chronic community. At Health Central, we created a series of condition-specific articles, everything from heart disease to autoimmune disorders to IBD, and how COVID impacted people with these illnesses. And we also paired them each with a Facebook Live, where our audience could ask questions to one of the doctors from our medical board. As we progressed along through the pandemic with our audience, we made sure our content changed in lockstep. So as the world began to reopen late last spring, we created a special downloadable booklet called 65 Little Ways to Navigate This New COVID World. We covered everything from how to deal with grief from the loss of a loved one to whether it was safe to go back to the gym or the nail salon. We're incredibly proud of all the work we've done to help our audience through the pandemic, and we hope our content continues to inspire them as they inspire us.
You can't talk about 2020 without talking about mental health. And this year, the conversations have not been easy. 1 in 5 COVID-19 patients will be diagnosed with a mental illness within 3 months of testing positive for coronavirus. 3 months. And those with pre-existing mental illness are 65% more likely to be diagnosed with corona. This all comes on the heels of a national shortage of psychiatrists. Now more than ever, mental health care is absolutely essential. And as a leader in the field for 25 years, PsyCom is committed to covering the pandemic like no other. Whether that's giving readers free self-assessments, helping them navigate their new abnormal, or exposing deep racial disparities in our healthcare system. We will continue to have these conversations, no matter how difficult, so that every American feels seen, heard, and gets the treatment they so deserve.
Meanwhile, the COVID-19 pandemic has also been exacerbating these long existing problems of systemic racism in healthcare in our country, as well as fear and stigma around the idea of infectiousness, the same kind of fear that's led to unjust HIV criminalization laws in our country, which still exist today. It's all a lot. So for us, the challenge on the body for people living with HIV and on the Body Pro for healthcare providers was to meet these many intersecting moments and needs with reliable information, with affirmation, with support, with realism, and with a sense of empathy that helps the communities we serve take the best care of themselves that they can and live to see a better day.
While there are no silver linings to COVID-19, its ripple effects have forced us to find new ways of making connections, including with our healthcare teams. And this extends to our frontline workers, who continue to provide the best level of care in very dangerous and often serious circumstances. At Health Central, we are going to continue to celebrate, to honor, and to appreciate all the work that our frontline workers do. And for that, we say thank you.